Okay, one of the questions I had is, why do I say that they're intentionally exposing us to infectious diseases? Well, when I first started working on the psychiatric unit, their clothes went out to be laundered. The hospital does not have an on-site laundry department, and psychiatric patients were not allowed to wear their street clothes when they were first admitted to the psychiatric unit. They had to wait for an order to be written by the physician that they can now wear street clothes. And there's a whole lot of reasons for that. People who are truly psych patients, and there is a difference, but people who truly have a mental illness, when they get to a certain level on the decline, they become very lax on hygienes. And so for the vast majority of them, when they come to us, most of them are at their worst. A lot of them, they become so aggressive, or behavior becomes so outrageous that they've been put out of wherever they resided. So a lot of them are on the streets. So when we get the patients, they come with their clothes. It's a force to be reckoned with. A lot of their clothes are filled with urine, feces, menstrual blood. A lot of them come in with infectious diseases such as herpes, genital warts, syphilis, gonorrhea, chlamydia, HIV, Hep A, B, C. Everything can be on the psychiatric unit at one time. So taking these clothes out to be laundered is essential to decreasing infectious diseases being transmitted from one person to the other. Well, the hospital decided they were tired of paying for it. Now, they were still sending the towels and the gowns and everything out to be laundered, but they were tired of doing this for the psychiatric department. And they also said that they were tired of paying for paper scrubs. So both of them ended. How they remedied that problem is they decided that they were going to put a stackable washer and dryer on the psychiatric unit in a little bitty closet. And it was not one of those commercial stackable washer and dryers, one of those real fancy ones. It was one that you would pay maybe $300 for, if that. This is what we use to launder clothes in. Now, on the psychiatric unit, we have always had a problem with warm water. These patients sometimes would take baths in almost cold water because it just would not come to the floor. It's almost as if the psychiatric unit is the last to get everything. This is what we were told we would have to do. Now, the people who would have to launder the clothes were behavioral health techs. And on the psychiatric unit, the behavioral health techs are 99.999% African American. You're not doing this on any other floor. This is strictly the psychiatric department. Anyone who works in any laundry department or any department where it is a vital department in cutting down the infection rate, it is supposed to be training and periodic training after that. Well, that didn't happen here. What they did was they put this washer and dryer into this little cubby hole, basically, and told them, you're getting Tide Pods, and everyone knows what Tide Pods is. Everybody's going to these pods and things. As far as with a psychiatric unit and the type of body fluids and things that I've spoken of, they were allowed one Tide Pod per load. Now, everyone knows that bleach is not allowed in medical facilities anymore, and there were no other disinfectant given to us. Period. You were to wash these clothes as if you were at your house. So anyone who knows anything about fixing things, because I came up with a very, very hard, rough life. I can pull a toilet up. I can pull pipes away from under the sink and unclog the sink. I'll go out there and I'll dig up sewage. So anyone who knows anything about a wash machine, that machine never fully empties out. If you ever get to an end of a load and you turn that machine over, you will get probably over a gallon of water that's left in that machine. So once you get through using one Tide Pod with all of this gumbo that's in these clothings, and not to mention, you supposed to have crack pipes in there, razor blades, needles. We've come across so much. So, and a lot of these patients, they will come there with entire suitcases. So we are expected to launder the patient's clothing in that water, that cold water with one Tide Pod, with absolutely no disinfectant, take that out and shove it into a dryer that is not vented out to the outside of the building, which means most of the particles end up airborne. Now, I have my associate degree in surgical technology, and we did a lot of cases. But no case was more different than when someone had genital warts and they come there to have them soldered off. We had to gown and glove in a totally different way, especially our face mask and things, because the smoke that comes from a cauterization machine, it has plumes of smoke. And that's just basically like if you light a match and you blow a match out and you see that little stream of smoke come up. Well, these things are basically invisible to the naked eye. So if this gets into your respiratory tract, guess what? You have a very high chance of having genital warts in your nose, throat, airway, lungs, all of that. And so no one wants to be breathing in any of this, period. This is what we're being made to do. And then right afterwards, we get someone else's clothes and we throw it in there. We throw it into a container that still holds about a gallon of liquid, a gallon of cold liquid with all of what I just said festering in it. It's basically a gumbo of whatever. Cold water and one Tide Pod and no disinfectant. And the cycle just repeats itself. You're doing this, you have 26 people, so this machine is going all the time. Except the machine was broke down probably 45% of the time. I don't think a week went by that we didn't have to have maintenance up there fixing the machine, because these machines are not built for that type of work. It's not made for you to constantly do this. Not only that, it's not made for a medical facility, period. And so we've complained time and time and time again over that. And some people, you may say, well, you can't catch anything like this and this. I want you to bring your children's clothing, your mother's clothing, and you launder them clothing behind all of these people and tell me how comfortable you feel. Because some things are just a matter of respect the person the way you want to be respected. Just because you're not poor or you're not someone who has a psychological problem doesn't mean that your life is any more valuable than these people. Not only that, you're exposing us to infectious diseases. They do not care.